The worst vitamin that causes leg weakness after 50. I know your legs are weak, lacking strength, or just too tired, especially after that demanding day. What if I told you that the culprit might be a daily habit you're not even aware of? Or worse, a vitamin you're taking thinking it's helping but is actually weakening you gradually. In this video, you'll discover 17 factors that destroy the strength of your legs after 50. From common behaviors to seemingly healthy mistakes like certain exercises or the misuse of specific supplements. And most importantly, I'll show you in the last chapter which vitamin is most dangerous for your nerves and muscles. You'll understand how small actions are affecting your circulation, your coordination, and even your ability to walk steadily. Want to know what's undermining your strength and what to do to regain vitality in your legs? Then stay with me until the end, because the last revelation could change everything in your routine and your health. Number 17, smoking. Smoking is extremely harmful to health in many ways, and its consequences go far beyond the lungs. One of the most silent yet devastating effects is the impairment of blood circulation. Nicotine and other substances in cigarettes cause the narrowing of blood vessels. This drastically reduces blood flow to the muscles, including those of less oxygen and nutrients. Muscles become weaker and more susceptible to pain. Ever felt your legs tired for no apparent reason? This could be linked to poor circulation caused by smoking. In the long run, the continuous reduction of blood flow can cause intermittent claudication. This condition creates pain while walking, forcing the person to stop frequently. The discomfort intensifies over time, severely affecting quality of life. It's not just a matter of independence. Tissue oxygenation is essential for proper muscle function. When oxygen doesn't arrive adequately, toxic substances accumulate and cellular wear accelerates. This not only causes weakness, but also reduces the capacity for muscle recovery. For people over 50, this loss is even more concerning. The body no longer regenerates with the efficiency of youth, making cumulative damage more dangerous. Moreover, smoking directly interferes with the absorption of crucial nutrients. Vitamins such as C and E, essential for the circulatory and immune systems, are compromised. The deficiency of these nutrients aggravates muscle weakening. And since the leg muscles are the most demanded in daily activities, they suffer the most. It's like living with the handbrake pulled. The body tries but cannot function fully. Another alarming factor is that smoking damages peripheral nerves. This affects communication between the brain and muscles, impairing reflexes and motor coordination. The loss of this connection can cause sensations of tingling, numbness, and insecurity while walking. All this combined contributes to falls and domestic accidents, especially in older adults. Smoking therefore directly impacts your safety while moving. Quitting smoking is one of the most important decisions for those who want to preserve leg strength and maintain independence. The benefits appear quickly within a few days. Circulation begins to improve. Over time, the risk of muscle pain and weakness significantly decreases. Number 16, excessive alcohol consumption. Drinking occasionally may seem harmless, but frequent and large-scale consumption is poison for the nerves. Alcohol directly affects the peripheral nervous system, causing a condition called alcoholic neuropathy. This condition causes tingling, loss of sensitivity, and muscle weakness, especially in the legs. The signs appear gradually and are often ignored until the pain becomes constant, and the worst part, by that point, recovery is more challenging. Over time, alcohol interferes with the absorption of vitamins essential to nerve function. One of the most affected is vitamin B1, whose deficiency is linked to muscle strength loss and chronic fatigue. The leg muscles, being the most used, suffer the consequences first. The simple act of walking can become a challenge. Falls increase and insecurity for performing basic tasks also rises. The toxicity of alcohol goes beyond the nervous system. It causes inflammation that's spread throughout the body, including the muscles. This hampers muscle recovery after physical activities and accelerates the process of muscle degeneration. In other words, even those who try to maintain a healthy routine might not see results if they continue to abuse alcohol. The musculature of the legs, so essential for mobility, is one of the first to be affected. It's important to remember that as the years pass, the body becomes less tolerant of alcohol. The same volume that previously seemed harmless can now be enough to cause metabolic imbalances. Leg weakness after 50 may be much more related to the glass than you imagine. Reducing or eliminating alcohol is a direct way to protect your strength and autonomy. Each drink less can be an additional step in your well-being. Number 15, sedentary lifestyle. Staying inactive might seem comfortable, but it can be destructive to your health, especially muscular health. Lack of movement reduces the necessary stimulus to keep muscles active and strong. Over time, this leads to muscle atrophy, which first manifests in the legs. You feel your legs weaker, tired, or even sore without even exerting yourself. It's the body complaining about inertia. Sedentarism also compromises blood circulation. Blood flows less efficiently to the lower limbs, which harms muscle oxygenation. This makes fatigue come faster, and muscle recovery takes longer. It's a vicious cycle. The more you avoid moving, the harder it becomes to move. This worsens with age when natural muscle loss intensifies. Even simple activities like climbing stairs or walking around the block can become difficult. Sedentarism steals agility and affects balance, increasing the risk of falls. And it's not just about aesthetics or body weight. The musculature of the legs is essential to ensure independence. Strengthening these areas doesn't require intense exercises, but rather consistency and regular movement. Muscle mass loss in the legs is one of the major causes of functional limitation after 50. That's why many people start depending on others for simple everyday tasks. The muscle that is not used to deteriorates over time, and sedentarism accelerates this process. Changing this can be simpler than it seems. Walking for 30 minutes a day is a good start. Avoiding long periods of sitting is also crucial. For every hour seated, stand up for 5 minutes, stretch, and move your body. Your circulatory system will thank you, and so will your muscles. Incorporating small movement breaks throughout the day can make all the difference. The key is consistency. What you do every day shapes the strength of your body in the long term. Number 14, diet rich in trans fats. Trans fats are well-known villains of cardiovascular health, but few realize how directly they affect leg muscles. Found in industrialized foods like margarines, field cookies, and fast foods, these fats promote inflammation in the body. This inflammation reaches the muscles, hindering their performance and weakening their structure. Moreover, trans fats interfere with blood circulation, making the blood thicker. In vessels, this compromises the arrival of oxygen and essential nutrients to the leg muscles. A poorly nourished muscle cannot stay strong and active. The feeling of heaviness in the legs and constant swelling may be linked to this unbalanced diet. The body responds to what you put on your plate. Another consequence of frequent consumption of these fats is the increase in bad cholesterol (LDL). This type of cholesterol accumulates in the vessels, further hindering circulation. It's a chain effect. Worse circulation, less oxygen, weaker muscles. This pattern is especially problematic for those over 50, when the musculature tends to become more sensitive and vulnerable. Have you ever noticed that after a very fatty meal, your body seems slower? That's a clear sign that your muscles are suffering. Digestion is compromised, metabolism slows down, and energy simply vanishes. In the long term, this habit takes a high toll: loss of strength, increased risk of injuries, and even difficulty climbing stairs. Energy vanishes and the legs feel at first. Avoiding fried foods and ultra-processed products is a simple yet extremely effective measure. Replace them with fresh foods such as nuts, olive oil, and fish rich in omega-3, which have an anti-inflammatory effect. These swaps benefit vascular and muscle health simultaneously. Your muscles will thank you with more vitality and endurance. And speaking of body care, in the last chapter of this video, we'll reveal the most dangerous vitamin for the strength of your legs. You'll be surprised. Number 13. Excessive consumption of soft drinks. Excessive consumption of soft drinks is more dangerous than many people imagine, especially when it comes to leg health. These beverages, besides being extremely caloric and poor nutrients, are rich in phosphorus. The problem is that an excess of this mineral can cause imbalance in the absorption of calcium and magnesium, essential for muscle function. This directly interferes with the strength and proper functioning of the legs. Besides phosphorus, soft drinks contain high amounts of sugar. This excess sugar contributes to inflammation in the body, reduces insulin sensitivity, and impairs muscle metabolism. In other words, sugar weakens the muscles, leaves you with less energy, and increases the risk of cramps and weaknesses. All this first affects the legs, which require continuous effort throughout the day. Another concerning point is that these beverages do not hydrate. In fact, frequent consumption of soft drink can even lead to dehydration, as the body needs more water to process so much sugar and additives, and dehydration is a key factor in the loss of muscle resistance. A poorly hydrated body has weaker, stiffer muscles, more prone to fatigue, especially in the legs. Have you ever felt heavy and without energy after lunch accompanied by a soft drink? That's no coincidence. The high glycemic index of the beverage causes a rapid rise and fall in blood sugar levels. This spike, followed by a drop, results in fatigue, muscle pain, and a feeling of weakness. What seems refreshing, in fact, drains your strength. And speaking of hindrances, there's something even more dangerous than soft drinks when it comes to leg strength. In the last chapter of this video, you'll find out which vitamin is the worst for this area of the body. Don't miss it. Number 12. Spending hours in bad posture. The way you sit might seem like a small detail, but it has a huge impact on the health of your legs. Spending hours on your phone or on the couch in the wrong posture compress important nerves in the spine and hips. This directly interferes with nerve conduction to the leg muscles. The result is numbness, tingling, and even loss of strength without you immediately realizing it. Poor posture causes the shortening of posterior muscles and weakens stabilizer muscles. When this happens, the biomechanics of your gait, that is the way you walk, is altered. You begin to compensate with other muscles, overloading the legs incorrectly. This not only causes weakness, but also pains in the joints and back. Another problem is the blockage of blood flow. When you cross your legs or bend over for too long, you compress important vessels that irrigate the lower limbs. This chronic compression reduces the oxygenation of muscles and delays muscle recovery. That's why, after long periods of sitting, you may feel your legs numb or heavy. Moreover, this prolonged position favors joint stiffness and loss of mobility. People who spend a lot of time sitting, especially those over 50, tend to have more difficulty climbing stairs or getting up quickly. The body adapts to immobility, and that means loss of muscle function. Without proper stimulation and circulation, muscles weaken. Correcting this habit is simple but requires attention. Stand up every hour, stretch, and avoid spending too much time in the same position. Use lumbar support. Keep your feet on the ground, and take care of your alignment of your spine when using your phone. Number 11. Frequent consumption of processed meats. Processed meats are practical and tasty, but they hide serious traps for muscle health. Sausages, hams, and mortadellas are rich in sodium-saturated fats and chemical additives. This inflammable combo affects blood vessels and hinders the arrival of nutrients to the legs. Result: poorly nourished muscles and increasingly weaker, especially in old age. Moreover, processed meats favor the accumulation of toxins in the body. These substances accumulate in tissues, causing chronic inflammation, and inflamed muscles do not function well. They become sore with less resistance and more prone to fatigue. This hampers everything from simple walks to light exercises, decreasing your autonomy. Another alarming point is the presence of nitrites and nitrates, preservatives used in these foods. Studies associate these additives with increased oxidative stress and premature aging of cells. This process directly affects the muscular and vascular system, interfering with muscle regeneration and the ability to maintain muscle tone. The result is a gradual, silent, and continuous weakening. Have you ever noticed swelling in your legs after eating very salty foods? This happens because excess sodium retains fluids, overloading vessels and muscles. Swelling is not only uncomfortable, but prevents muscles from moving efficiently. And constant retention also causes stiffness, which limits movements and increases the sensation of heaviness in the legs. The best alternative is to reduce the consumption of these foods and opt for more natural proteins such as eggs, chicken, or fresh fish. Avoiding processed meats is a fundamental step in preserving muscle strength and improving circulation in the legs. Number 10. Training with excessive load without guidance. Physical exercise is essential to maintain leg strength, but when done incorrectly, it can have the opposite effect. Training with very heavy loads without proper guidance compromises muscles, tendons, and joints. This is especially risky after 50, when the body needs more care and preparation. excessive weight can cause serious injuries such as muscle tears and joint inflammation. And the worst part, these injuries often leave lasting consequences. The muscle, when overloaded beyond the safe limit, enters a process instead of strengthening. Recovery becomes slower, and the risk of chronic pains in the legs increases. Moreover, incorrect execution of movements, especially without supervision, can affect posture and stability. This overloads other body areas like the knees and lower back. All this reduces the quality of the workouts and consequently muscular health. The problem also affects ligaments and joints, which are not prepared to support so much weight. The result can be the compromise of the support structures of the legs, reducing your mobility instead of walking or climbing stairs. This generates frustration and fear, which often leads to the abandonment of physical activity. A danger is set back for health. Enduring yourself by overdoing it is a common and entirely avoidable mistake. Besides physical damages, training excessively without guidance can cause oxidative stress. This means there is an exaggerated production of free radicals which attack muscle cells. The inflammation caused by this process weakens the muscles instead of making them stronger, and this can take weeks or months to recover, especially in older people. The body needs stimulation, but also respect for its limits. The solution lies in balance, training moderately with proper guidance, and paying attention to the body. A physical education professional can adjust the loads according to your capacity and goals. The focus should be on strengthening without harming, building a solid and healthy foundation. Stretching, warming up, and rest breaks are equally important to avoid injuries. Training correctly is training safely. And stay tuned, because in the last chapter of this video, we'll reveal the vitamin that can cause exactly the type of muscle weakness that many try to avoid with training. Number 9. Prolonged exposure to cold. Cold environments may seem harmless at first glance, but prolonged exposure to cold directly affects the health of the legs. Cold causes vasoconstriction, the narrowing of blood vessels. This mechanism reduces blood flow to the body's extremities, especially to the feet and legs. With less oxygen and nutrients arriving, muscles become weaker and less responsive. The sensation of stiffness, tingling, and even pain is common in this scenario. Moreover, cold tends to limit our movements. In low temperatures, people naturally move less, which further aggravates poor circulation. This combination, cold and immobility, weaken the leg muscles over time. For people with circulatory problems or advanced age, this becomes even more dangerous. The risk of cramps, falls, and leg pain increases significantly. Another point is that many neglect to wear proper clothing to protect the legs in the cold. Spending too much time with legs exposed to low temperatures can cause intense muscle stiffness. This hampers walking and causes fatigue, even in simple tasks. Muscles need to be specially after 50. Ignoring this need compromises body performance. It's common for physical activity to decrease in cold seasons, but maintaining a routine of movement is essential to avoid muscle loss. Even indoor walks, stretching, and light exercises help keep blood flow active. Number 8. Using flip-flops or inadequate footwear for too long. Continuous use of flip-flops and inadequate shoes is one of the great villains of postural health. These shoes generally do not provide proper support for the feet directly, affecting the way you step. An irregular step overloads the knees, ankles, and hips, deregulating the entire muscle chain of legs. In the long run, this leads to pain and weakness in the lower regions of the body. Flip-flops, for example, require that the toes constantly contract to hold them. This causes unnecessary muscle tension and compromises the natural step. Over time, the leg musculature suffers an imbalance. Some muscles work too much, others too low. This uneven distribution of effort weakens the muscular structures, causing instability and even falls. It's like walking with unregulated brakes. Another common problem is the lack of cushioning. Footwear without good impact absorption increases pressure on the joints with each step. This constant stress affects the knees and weakens the surrounding musculature, weakening the legs. People over 50 who already have lower muscle density feel this more intensely. Pain becomes a daily obstacle and limits simple activities like walking or standing for long periods. Inadequate footwear also influences circulation. An incorrect step can compress important blood vessels, hindering the oxygenation of the legs. The consequence is swelling, the sensation of heavy legs and fatigue at the end of the day. This may seem subtle at first, but it becomes chronic over time. Many suffer from these symptoms without even imagining that footwear is to blame. Number 7. Prolonged use of certain medications. The continuous use of medications is a reality for many people after 50, especially those that treat high cholesterol, like statins. Although effective in reducing bad cholesterol, these drugs can cause unwanted side effects on the muscles. One of the most common is myalgia, or diffuse muscle pain, which often affects the legs. Besides the pain, many report a feeling of weakness and loss of physical performance. These symptoms are caused by the action of statins on the mitochondria, which are responsible for cellular energy production. When these structures are compromised, the muscles have less energy to function properly. The result is constant fatigue and difficulty even in simple activities like climbing stairs. In more severe cases, there can be progressive muscle degeneration. It's an alert that many ignore, but that directly impacts mobility. Another worrying factor is that these medications are usually used indefinitely, often for decades. This means that even mild effects can accumulate over time, causing great damage to the musculature. If you feel that you have lost strength in your legs after starting treatment with statins, talk to your doctor. There are alternatives or adjustments that can preserve your muscular health. Besides statins, other medications such as ultrametabolism promote fluid retention or interfere with muscle contraction. Identifying side effects and monitoring the impact on the body is essential. After all, what helps in one aspect may be harming another without you realizing it. It's not about abandoning treatment, but about closely following the signs of your body. Individualizing therapy with medical guidance is the safest path. Do not ignore persistent muscle pain or a feeling of weakness after prolonged use of medications. These signs are a cry for help from your organism. Number 6. Excess sodium in the diet. Excess salt is one of the biggest enemies of cardiovascular health, but its impact on the legs is also alarming. When you consume too much sodium, your body retains more fluid to balance the salt levels in the blood. This accumulation of fluids causes swelling, especially in the legs and ankles. With swollen tissues, muscles are compressed, making their movement difficult and causing a sensation of heaviness. Besides swelling, excess sodium also affects blood circulation. Blood pressurizes and vessels become stiffer, compromising the transport of oxygen and nutrients to the muscles. This poor circulation results in early fatigue and weakness, especially in the legs, which are the most demanded throughout the day. The body needs electrolyte balance to function well, and excess sodium messes up this entire system. Industrialized foods, such as processed meats, ready-made sauces, snacks, and canned goods are the main villains in this regard. Often a single meal exceeds the daily recommended limit of sodium without the person realizing it. In the long term, this contributes not only to hypertension but also to muscle weakening. It's like the body is always fighting against an invisible swelling that blocks its full functioning. Chronic swelling also affects the joint. With more fluid around, movements become limited and muscles need to exert more effort to perform simple tasks. This extra effort leads to faster fatigue and can cause constant pain. Moreover, this fluid retention overloads the lymphatic system further, complicating muscle recovery. Number 5. Frequently sleeping poorly. A good night's sleep is one of the pillars of muscle health, and this is especially true for the legs. During sleep, the body goes into recovery and regeneration mode. It's at this time that muscle tissues repair themselves, anabolic hormones are released, and accumulated fatigue is relieved. Sleeping poorly compromises this entire process and leaves the muscles vulnerable to wear. And once again, the legs are the first to suffer. Sleep deprivation reduces the production of hormones such as GH, the growth hormone, and testosterone, which are essential for maintaining strength and muscle endurance. Without these hormones at adequate levels, the body loses muscle mass and accumulates fat. The consequence is a gradual loss of energy and performance, noticeable in the legs during walks, exercises, or even while standing for long periods. Another critical point is the increase in cortisol, the stress hormone. Inadequate sleep raises the levels of this substance, which has a catabolic effect, i.e., it promotes the breakdown of muscle tissue. This accelerates the weakening of the legs, causes pain, and increases the sensation of fatigue. Over time, the body enters a constant state of alert, unable to recover properly, a dangerous and silent cycle. Moreover, sleeping poorly affects balance and motor coordination. The brain becomes less efficient in commanding the muscles, increasing the risk of falls and stumbles. This is especially risky for people over 50 who already have reduced reflexes and muscle tone. The combination of fatigue, muscle mass loss, and postural instability is a recipe for accidents. Establishing a sleep routine is essential for muscle health. Sleeping between 7 and 9 hours a night, maintaining regular hours, and avoiding stimuli such as blue light before bedtime are simple and effective measures. Your body needs this time to recover, and your legs depend on it to remain firm and strong. Do not neglect rest. Number 4. Sitting for long periods during long trips. Long trips may seem like moments of rest, but for the legs they are periods of stress and stagnation. Sitting for a long time without moving the legs drastically reduces blood flow. This causes fluid retention, tingling, and a sensation of heaviness in the lower limbs. When blood doesn't circulate well, muscles receive less oxygen and nutrients. The result is a feeling of weakness and stiffness when trying to stand up. During these long hours of immobility, muscles enter prolonged rest. Unlike the active rest of sleep, here there is no stimulation at all for the synced muscle fibers. This state leads to a slight temporary atrophy, which worsens with the frequency of the trip. In the long term, this can contribute to the progressive weakening of the legs, especially in people over 50. Moreover, prolonged compression of blood vessels in the thighs and calves can cause more serious problems. In extreme cases, there is a risk of deep vein thrombosis, a dangerous condition caused by blood clots. Sudden pain, swelling, and redness are warning signs that should not be ignored. Leg health during trips requires extra attention. The good news is that there are simple ways to avoid these problems. Taking small breaks to walk, stretching legs, or even moving them while seated already helps a lot. Compression socks are also a useful option for frequent travelers. The important thing is to ensure that blood keeps flowing through the legs. Another important tip is to stay well hydrated during the trip. Number 3. Doing leg press with an ease too extended. The leg press is one of the most popular exercises in gyms, but also one of the most dangerous when performed incorrectly. A common mistake is to extend an ease too much at the end of the movement, locking the joint. This movement puts tremendous pressure on the ligaments and joints, especially the knees. In the long term, this can cause injuries that compromise the leg muscles and body balance. When you fully extend the knees on the leg press, the effort shifts from the muscles to the joints. This repeated impact weakens the ligaments, making them more susceptible to tears, and without firm ligaments, muscles lose support and stability. This leads to insecurity in movements and difficulty in daily tasks, such as climbing stairs or squatting. Another critical point is that this habit harms the alignment of the spine and hips. The excessive force is absorbed by the back and pelvis, which try to compensate for the poor execution. This overloads the leg muscles asymmetrically, leading to pain, fatigue, and muscular imbalance. The consequence is an increasingly worse performance even with frequent training. This type of injury can be even more detrimental in people over 50. As we age, tissues tend to be less elastic and muscle recovery is slower. A small technical error can result in a significant functional problem. The risk of aggravation is real and increases over time. To avoid this, the guidance of a physical education professional is indispensable. The correct technique is to maintain a slight bend in the knees at the end of the movement without locking them. Moreover, it is essential to adjust the weight to your real capacity without exaggerations. Executing correctly is more valuable than lifting a lot. Number 2. Consuming many ultra-processed foods. Ultra-processed foods are practical and tasty, but their frequent consumption exacts a high toll on muscle health. Full of chemical additives, colorants, preservatives, and bad fats, these products are poor in essential nutrients. This means that despite excess calories, they do not provide what the muscles need to stay strong. The result is the loss of muscle mass and a constant sensation of weakness. Moreover, these foods promote chronic inflammation in the body. This silent inflammation directly affects the muscles, hindering their recovery and regeneration. The more inflammation, the greater the muscle wear, and the lower the physical resistance. In the long term, the legs begin to respond with less strength and more pain. It's as if they were always discharged. The digestion of ultra-processed foods is also problematic. They tend to be rich in sodium, sugar, and trans fats, which enter the absorption of important nutrients like magnesium, potassium, and vitamin D. These nutrients are essential for muscle contraction and relaxation, especially in the legs. Their deficiency compromises the full functioning of the muscles and increases fatigue. Moreover, excessive consumption of ultra-processed foods is associated with weight gain and accumulation of visceral fat. This type of fat favors the emergence of metabolic diseases that also affect the musculature. The more abdominal fat, the greater the burden on the legs, leading to progressive loss of resistance. It's a silent but devastating domino effect. Switching ultra-processed foods for natural foods is one of the most important decisions for muscle health. Fruits, vegetables, lean proteins, and nuts should take the place that snacks, cookies, soft drinks, and frozen foods currently occupied. Your body will feel the difference in a few weeks: more energy, fewer pains, and much more strength. And speaking of strength, in the next chapter, we will finally reveal which vitamin, if taken in excess, might be behind the weakness in your legs. This is the most important revelation of the entire video. You can't miss it. Number 1. Excess vitamin B6. Few people imagine that a vitamin normally associated with health can cause serious muscle problems. Vitamin B6, or pyridoxine, is essential for the functioning of the nervous system and muscles. However, when consumed in excess, especially through supplements, it can become a real poison for the legs. High doses of this vitamin affect the peripheral nerves, causing alarming symptoms. Among them are numbness, tingling, and particularly muscle weakness. The condition is known as vitamin B6-induced peripheral neuropathy. It is a neurological disorder where the nerves responsible for movement and sensation in the legs are damaged. The most dangerous aspect is that the symptoms appear gradually, often confused with natural aging or circulation problems. Leg weakness intensifies, motor coordination is lost, and even walking becomes a challenge. All because of supplement that many take believing they are doing good. This situation is more common than it seems, especially among people who use multivitamins or B-complex supplements without medical guidance. The daily recommended dose of B6 for adults is about 140 to 2 milligrams, but many supplements contain 50, 100, or even 200 milligrams per capsule. When this consumption extends for weeks or months, the risk of poisoning increases exponentially. The excess is not quickly eliminated by the body and accumulates, affecting nerves with devastating effects. People over 50 should be even more cautious. With slower metabolism and greater neuromuscular, toxic effects appear more quickly. The loss of leg strength may be accompanied by pain, nighttime cramps, and imbalance while walking. Often, patients undergo a long journey of consultations and tests before discovering that the problem came from a supplement. It's an urgent alert about the dangers of excess of what is good. Symptom reversal is possible, but depends on the immediate discontinuation of the supplement and medical monitoring. In some cases, recovery is slow and may leave sequentially. Therefore, it is essential never to supplement on your own, even when it comes to vitamins. They should be viewed as medications with safe doses, limits, and supervision. The body needs balance, and excess B6 can silently destroy it. And if you want to keep receiving the best videos for your health, subscribe to the channel, because it exists for one simple reason: to make you a healthier person with a better quality of life. Helping you is my mission. In the video that appears now on your screen, I reveal the worst food that is destroying your vision and causing other diseases. Click on the screen and check it out. So until the next video. It's called vitamin B6-induced peripheral neuropathy, a serious neurological condition where the nerves responsible for movement and sensation in your legs are damaged. The most alarming part: the symptoms develop so gradually that they can easily be mistaken for normal aging or circulation issues. Leg weakness worsens over time, motor coordination begins to falter, and before you know it, even walking becomes a struggle. What's worse, this condition is far more common than we realize, particularly among those who take multivitamins or B-complex supplements without proper medical advice. While vitamin B6 is essential for overall health, the recommended daily intake for adults is just 1 to 2 milligrams, but many over-the-counter supplements contain much higher doses, 50, 100, or even 200 milligrams per capsule. When consumed over weeks or months, the risk of poisoning skyrockets. The body doesn't eliminate this excess B6 quickly, it accumulates in your system, wreaking havoc on your nerves, and the damage can be irreversible. If you're taking these supplements regularly, it's time to check the label and reassess. Always consult a healthcare professional before starting any new supplement regimen. It's not just about doing good for your body, it's about doing it the right way. Let's prioritize our health, not by blindly following trends, but by being informed and cautious. If you're over 50, this is something you absolutely cannot ignore. Your metabolism is slower, and the risks of neuromuscular toxicity are much higher. The danger, a loss of leg strength that may come with pain, nighttime cramps, and a sense of imbalance when walking. Here's the shocking truth. Many people go through endless consultations, tests, and specialists, only to discover that the real culprit was a supplement. Yes, you heard that right. The very thing you thought was helping could be hurting you. This is an urgent alert. More isn't always better, and sometimes, too much of what's good can wreak havoc on your body. The good news is, symptom reversal is possible, but only if you act quickly. Discontinuing the supplement immediately and getting medical supervision is key. But beware, recovery can be slow, and in some cases, it may happen in stages. So please, never take supplements on your own, without proper guidance, even vitamins. Think of supplements like medications. They come with safe dosages, limits, and most importantly, the need for supervision. The body thrives on balance, and excess B6 can silently sabotage it, causing damage without any clear warning signs. Remember, your health is too important to leave to chance. If you want to keep learning about how to stay healthy and improve your quality of life, hit that subscribe button. This channel exists for one simple reason: to make you a healthier, happier version of yourself. Your health is my mission. In the video now on your screen, I'm uncovering the worst foods that are not only damaging your vision, but also contributing to other serious health issues. Click on the screen to watch and learn more. Stay tuned for the next video.